So people who have had severe trauma, being accessible is a sign that they'll be traumatized again. And that's where therapists have to be clever and have to understand what the goal is to get that body calmer. And so medication can literally downregulate behavior and physiological state, but it doesn't enhance the neural regulation of those calming systems. So there may be a place for acute medication, but it may not be very effective in recruiting the ability of the nervous system to process signals of safety.
Welcome to the Mind Health 360 show. I'm Kirkland Newman, and if you, your loved ones, or clients suffer from mental health issues such as depression, anxiety, insomnia, poor memory, poor attention, mood swings, exhaustion, etc., I interview the leading integrative mental health practitioners from around the world to help you understand the root causes of these symptoms, many of which may surprise you and suggest solutions to help you heal. If you like this interview, please do subscribe and forward to others who might find it helpful. If you want further information, please go to www.mindhealth360.com or find us on social media. So welcome to IMMH 2023. We're absolutely thrilled to have you here. As the founder and editor of Mind Health 360 and the host of the Mind Health 360 show, it's long been my aim to bring about a revolution in the way mental health is diagnosed and treated, and to promote a more integrative, personalized, root cause, precision, and/or functional medicine approach, whatever you want to call it, to mental health. I was therefore thrilled to be entrusted to take forward the largest and best recognized integrative mental health conference, IMMH, by its founders, Dr. Shaw and Dr. Greenblatt. Despite the fact that many of us are weary of online learning, over 400 people from around the world have registered for this event, which shows the growing interest in integrative medicine, but also the power of our world-class speakers, the legacy of the IMMH brand, and the vision of its founders. But it's also the result of your dedication and vision for taking time out of your busy schedules to learn more about this medicine of the future. So thank you. We're also incredibly excited to announce our return in person, October 9th to the 13th, 2024 in Washington, D.C. And speaking of a revolution in mental health, Dr. Seth Porges has done a huge amount to advance this much-needed revolution with his groundbreaking polyvagal theory, which has in many cases profoundly changed mental health treatment by looking at it through the lens of the physiology of the nervous system. He's obviously had an illustrious career with numerous accolades. He's a distinguished university scientist at Indiana University. He's the founding director of the Traumatic Stress Research Consortium at the Kinsey Institute. He's a professor of psychiatry at the University of North Carolina, professor emeritus at the University of Illinois at Chicago and the University of Maryland. He's published over 400 peer-reviewed scientific papers, and his research has been cited in over 50,000 peer-reviewed publications. He's the author of several books, including The Polyvagal Theory, Neurophysiological Foundations of Emotions, Attachment, Communication, and Self-Regulation, and his latest book, Our Polyvagal World, How Safety and Trauma Change Us, was co-authored with his son, Seth Porges. He's also a mental health entrepreneur. He founded the Polyvagal Institute, and he's the creator of a music-based intervention, the Safe and Sound Protocol, which currently is used by approximately 3,000 therapists to improve spontaneous social engagement, which, as you will learn, is something akin to the Holy Grail. He's a giant in the field, and we're incredibly lucky to have him with us. But he's also one of the nicest, kindest, most thoughtful, and least egotistical people you'll ever meet. And he's known to be a scientist with the heart of a clinician. So welcome, Stephen, and thank you so much for being here.
Well, thank you, Kiki. It's really a pleasure to join you in this important meeting. And thank you for the introduction that I do like, a scientist with the heart of a therapist. It's very important to me that people realize that I am not that other kind of scientist. Anyway, so I'm really pleased to be here. I'm going to press that magic button, the screen share, and we're going to be off on our very rapid talk. So the title is really The Impact of Trauma on Mental and Physical Health Through the Lens of the Polyvagal Theory. And what that really means is that there's no distinction between effects on our mind or our mental state in our body. They both respond to trauma in a predictable way, or they respond to threat in a predictable way. And so we'll start, in a sense, deconstructing that through this talk and explaining that there's no separation between brain and body or mind and body. And this is important as the, in a sense, the basis of integrated medicine or functional medicine is the importance of the nervous system. And so the bridge between mind or brain and body is the nervous system, and the nervous system is a bidirectional system. And consistent with the theme of the conference, the communication between the system is done biochemically, although from my perspective, I look at nerves. So the talk will really emphasize that evolution, and this is how the species have changed over time, but really the evolution of vertebrates, species with backbones, and how the autonomic nervous system changed through phylogeny, or the evolutionary history of species. And what we learn is that as the autonomic nervous system changed, it functionally became an enabler of social behavior. In a sense, it enabled us to calm down and signal each other with cues of safety. And that enabled sociality, co-regulation, connectedness, bonding, attachment. All these features are literally a product of our autonomic nervous system being in specific states. But what's unique and especially important is the fact that sociality is an enabler of health, because sociality is sending signals of safety to our nervous system, downregulating our threat reactions. And remember, we live in a world in which threat reactions dominate our culture and our environment. And those threat reactions are real. They can be, in a sense, important to our own survival. But what we have to continually remember is our nervous system evolved to do well with threat, but it needs sufficient nourishment through sociality or co-regulation. Basically, it needs signals of safety so it can recover. And this supports our homeostatic functions, health, growth, restoration. And we're going to include in the homeostatic functions sociality. So it's not merely health, growth, and restoration, it's sociality. So polyvagal theory focuses on exploring relationships between the autonomic nervous system, specifically its regulation, and human behavior and experience. The important take-home point is that the autonomic nervous system serves as an intervening variable. And this is the important theme of the talk, because we live in a world that thinks of our bodies, our behaviors, our physiology, our health as cause and effect. Therefore, we seek to fix things through external interventions. We want to change the wrong that's been done to the body, to the nervous system, to the culture. But the autonomic nervous system sits in between the stimulus and the response, the cause and the effect. And if the nervous system isn't welcoming to the intervention becomes ineffective. And so we have to start understanding that perhaps the primary, if not the first, portal of intervention is, how do we calm our autonomic nervous system? How do we make our nervous system welcoming to intervention? How do we make our nervous system welcoming to sociality, in which sociality can be elevated to being a neuromodulator? So there are a lot of scientific disciplines out there that are interested in autonomic state, and they relate it to behavior. And there's a whole list of them. But if you look carefully at these names of these subdisciplines and specialties, you'll see them as treating the autonomic nervous system as a biomarker, as a correlate. Polyvagal theory does something different. It doesn't treat it as a correlate. It treats it as an intervening variable. Polyvagal theory is focused on measuring that chronic physiological state, that organismic state that could be basically described as a stimulus organism response model of life, SOR. So as the individual's vulnerability and accessibility of the challenge changes, that changes the O. So what we want to do is optimize the O, the organismic state, to enhance interventions, to enhance health, to enhance education, to enhance sociality. Predictions of biobehavioral reactivity from chronic states become critical. So now we can start looking at assessments of that intervening variable, and we make predictions of reactivity or vulnerability, even during incidences like the pandemic. So make predictions about whether people are affected by pathogens or affected by threats in the culture. Threats in the culture and threats in the nervous system share common space, and that is a nervous system that has been retuned to be in a state of threat. So we now start investigating plausible strategies of intervention targeted at changing the autonomic state. And that becomes the treatment aspect of the theory. So you have a model that puts physiological state, autonomic nervous system, in between stimulus and response. Then you start thinking about autonomic state as an assessment of vulnerability. And then optimistically, you move to the next level, and that is, can we literally find portals to that autonomic state to, in a sense, enhance its regulation? And in doing that, does it change the whole profile of an individual's behavioral repertoire? So when we were in school or in graduate school, we learned about the autonomic nervous system, and we basically learned about it as a paired antagonistic system in which the sympathetic was basically this accelerator, and the vagus, and which is the primary nerve of the parasympathetic nervous system, was a brake. And we talked a lot, and it's still being talked about as autonomic balance: too much sympathetic, too much vagal, too little this, too little that, and we start getting into, well, maybe we need to enhance this or push that. The way of thinking of it, was in part useful, but it's very dated, and it was a perspective that is over 100 years old. And we're going to kind of update it now, because going into this balance theory, balance has some meaning. It is useful, but it lacks inference to treatment and understand or explanation. And what I really want to emphasize now is that polyvagal theory is a theory of explanation. And from that explanation, people get other hypotheses about how to treat it. It's not a theory of treatment, it's a theory of explanation. So what we start to learn is that through evolution, which is reflected in the embryology, the development of mammalian species, of humans, is that we literally have two vagal pathways. We have one that exits the brain. First of all, the vagus is a cranial nerve that exits the brainstem and then goes to all these various organs. And that's why there's so much interest in it, because not only does it go to the organs, but it carries information from those organs. So it's a bidirectional superhighway of information between the body and the brain, specifically the brainstem. And in fact, the issue of like the microbiome, which is now very, let's say, a commonly discussed point, the afferent, the sensory part of the vagus, is where that information goes from the gut and goes up to the brainstem, sending signals of safety or threat about the organs. But when you look carefully at the vagus, what you start to realize is that there are literally two different branches of the vagus. And the vagus is this cranial nerve, but within it, it has different pathways. So we have to think of the vagus not as a unified nerve, but as a conduit containing different pathways. And there are two motor pathways, one coming from the ventral front part of the brainstem that goes to the heart and lungs and goes to the vocal cords, goes to the larynx and the pharynx. The interesting part of this vagal system is that it got intertwined through evolution with the nerves and muscles that control the face and the voice and listening. So our social behavior became linked to this vagus. And this vagus is above the diaphragm, it's myelinated, and it's a unique pathway that is common to mammals. And this evolutionary journey of moving cardioinhibitory neurons from the brainstem, from the back of the brain to the front of the brain, resulted in the ability of mammals to broadcast their physiological state to another. And so in the intonation of their voices, literally, mammals communicate whether they're safe to come close to. And then also we learned about ingestion, suck, swallow, and breathe as a calming mechanism, which now uses sensory information through those same pathways. So we have this ventral vagus going to heart, lungs, and basically to the larynx and pharynx. The laryngeal and pharyngeal nerves are vagal nerves, but they are not visceral vagal nerves. They're running striated muscle. And then you have the subdiaphragmatic vagus, which also has some pathways to the heart and to the bronchi, but not many. Most of them are going below the diaphragm, and this overlaps or is shared with virtually every vertebrate in our, let's say, vertebrate tree. So polyvagal theory derived from the phylogenetic and developmental investigations of the autonomic nervous system that identified a sequence during which the brainstem structures regulating the autonomic nervous system emerged during vertebrate phylogeny and are paralleled in mammalian ontogeny, meaning in our embryology and development, we can see this migration occurring as our brainstem regulation of autonomic nervous system shifts literally from a reptilian type to a social mammal type. It provides a theoretical basis for a neuroscience of safety, which is intertwined with sociality and explains how safety promotes spontaneous social engagement behaviors and health, growth, and restoration. It explains how autonomic state is optimized during safe social interactions and disrupted during states of defense. So from a illness or health perspective, medical treatments, whether they're for mental health or physical health, are less effective when the body is in a state of threat. If the body can be calmed or safe, the nervous system becomes literally inviting to the intervention. So we can see in the slice of the brainstem that there are two areas of the brainstem, a dorsal vagus and a ventral vagus. And these both go into the nerve called the vagus. And there's also some pathways in the vagus nerve coming from the spinal nucleus of the trigeminal or cranial nerve number 5. And nucleus solitarius is this massive sensory vagus coming up from the body. Literally, that's where the microbiome information, that's where information on blood pressure, that's where information on vascular activity, all the sensory information, and especially the gut, which is just loaded with afferents, are sending that information up to the brainstem. So we can see that the construct, the vagus is only a construct because it's truly a cable, not a unified nerve, and that we need to start talking more specifically about the pathways in the nerve. And in polyvagal theory, we emphasize the ventral vagus and the dorsal vagus because the ventral vagus is the one that goes to our heart and to our face. And we can see the migration. And we can see that even the earliest mammals could nurse. And this gives you a deconstruction of how the cranial nerves function together, or let's say components of them function together to become a social engagement system. And again, cranial nerves as an organizing principle is very, very limited. Cranial nerves are really conduits. They have sensory and motor, and sometimes the sensory and motor, there are more than one motor pathway. They come from different places and they have different functions. But we're going to focus on a subcategory of these cranial nerves, and these fibers are called special visceral efferent. And special visceral efferents, or most of them, come from the pharyngeal arches. So these are the ancient gill arches, and that's where, in a sense, fish would extract oxygen from water. And they're basically the bones of our face, or those ancient gill arches. But the muscles that are now related to those bones are what are called are regulated by the special visceral efferents. And so you have muscles, the 5 cranial nerves that contribute to these special visceral efferents, or the trigeminal, the facial, the glossopharyngeal, the vagus, and accessory. And they determine muscles of mastication, the middle ear muscles, which when they are working well, they dampen low frequency sounds so that we can hear human voice. Facial muscles, for facial expressivity, laryngeal and pharyngeal for intonation of our vocalizations, and putting those muscles together, they coordinate sucking, swallowing, and breathing, and head turning or head nodding. And then you have the visceral motor, and that is the bronchi and the heart. And this is through the vagus. So this part is through the visceral vagus. So at birth, mammals have this bidirectional face-heart connection. And what that does, it enables a communication between the face and the heart to allow suck, swallow, breathe, and vocalize, which forms the core, not merely of nutrients, in a sense, ingestion for the baby, but also of social nourishment, social engagement. So, in fact, with babies, as they start approaching like 9 or 10 months of age, the social stimuli become more potent than food. So, you giving food may not regulate the child. The child may be looking for or listening for the smiling face and the intonation of the mother's voice, the signals of safety. Metabolic demands such as danger, life threat, illness, retract the social engagement system, resulting in a face that is not social and a physiological state, the removal of that ventral vagal brake on the heart that now enables the heart to beat faster, produce more metabolic output, to promote defensive behaviors. So the point is that our face and our voice are going to reflect the physiology of our body, the autonomic state, when it's being attacked by a pathogen. And interestingly, a flat face due to trauma, a psychological disruption, is similar to a flat face of someone who is fighting a pathogen. Face and voice broadcast our autonomic state. And whether you are a therapist or a spouse or a parent or a friend, you're acutely aware that the people in your life communicate their feelings to you in their face and in their voice. Those feelings have a definable physiological substrate that is measurable. Basically, when their faces go flat, that ventral vagus has just turned itself off, prepared the individual to be defensive. Cues of safety work through this face-heart connection, and they can actually be potent regulators of the autonomic state, leading us to now say that sociality can act as functionally a neuromodulator, or succinctly state, it can stimulate the vagus. So rather than using auricular and air vagal nerve stimulator or doing a surgical implant for a vagal nerve stimulator, sociality with a trusted, safe individual will be very helpful in regulating our physiology. So polyvagal theory links this sociality to homeostatic functions. We can see the newborn young infants with their mothers, and we see a couple things happening in these pictures. We see the babies giving up their defenses and their bodies conforming to the mother, but we also see the mother giving up the tightness, the rigidity of their muscles, in a sense, giving up their defenses and now conforming to the body. So you're seeing immobilization without fear. And it's during immobilization without fear that healing properties occur. Our body does its best to improve or to serve the needs of its organs. And we can see how reciprocal face-to-face interactions regulate physiological state. We see a mother and a child. On the right top picture, we see peers. In the lower left, we see another primate, but you see the face-to-face. And if you look to the lower right, you see a trans-species relationship. And what I want to direct your attention to is the orbital muscle around the eye. That orbital muscle is called the orbicularis oculi, and it kind of tells you what physiological state the person is in, and whether it's part of it's regulated by a branch of the facial nerve, but that branch of the facial nerve also goes into the middle ear structures and regulates the stapedius, the middle ear muscle. And that middle ear muscle, when that muscle is tense, it filters out background sounds and enables vocal communication in a social range. So the sounds of a mother talking to her baby or a couple talking to each other, they'll use prosodic voices, sing-songy voices. That gets optimized when the orbicularis is working and the middle ear muscles have tension. So the focus, as I said in the beginning, is about autonomic nervous system being an intervening variable. And we can conceptualize it literally as a traffic light, that we are living in a world and stimuli are always impinging on us. And depending upon the physiological state we're in, we'll have a different response. So it's not like we respond the same to every stimulus. Our responses are modified or mediated by our physiological state. And this resonates with the statement that Viktor Frankl, or at least has been attributed to Viktor Frankl. He says that between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. And really what he's saying things similar to what I have said. Obviously, he said them long before me, but basically he's saying that we react to stimuli, but our responses, if we delay it, if we make space, if we explore our physiological responses, which are really our interoception that get triggered by our neuroception of threat, and I'll articulate what neuroception is a little bit later. But if we explore our own feelings, our own physiological state before reacting, that gives us the opportunity to step out of the script of basically reacting and becoming both socially reactive, but also physiologically reactive. Dissolution is a powerful construct within the theory, and this was developed by John Hillings Jackson in the late 1900s, and the late 1800s. And what Jackson said, he says that the higher nervous arrangements inhibit or control the lower, and thus when the higher are suddenly rendered functionless, the lower rise in activity. Embedded in this statement are two constructs that are used in polyvagal theory. One is hierarchy, and the other one is dissolution. Hierarchy is really that newer circuits inhibit older ones. And this is how the nervous system builds on itself, tiers itself. So newer circuits literally repurpose older circuits by constraining or kind of regulating them. And dissolution is literally the peeling off of the function of these newer circuits. And what he was really articulating is that brain damage or brain disease disinhibited older circuits. Polyvagal theory goes with that same type of hierarchical model and dissolution, and really talks about this newer supradiaphragmatic vagus with that ventral vagal pathways as creating the constraints of the rest of the autonomic nervous system, literally repurposing sympathetic activity from fight flight to play, and repurposing immobilization from immobilization as freeze and death feigning to moments of intimacy where our bodies are safe enough to give up their defenses. But if we take off the myelinated social engagement system, then our nervous system becomes vulnerable to be defensive. And first it will use the sympathetic nervous system, and that actively is inhibitory of the shutting down defensive system. And you will find in many of your patients or clients that if they are locked in states of sympathetic activation, they may have a history in which they had immobilized and experienced life threat. And so the mobilization sympathetic tone keeps them falling into that, I call it the deep, dark abyss. But the problem with the abyss is that they could pass out and they not get sufficient oxygen. So there's literally adaptive function. But the sympathetic nervous system, when used in defense, is metabolically costly, and the body can't maintain that. So the person becomes vulnerable to slip into, in a sense, immobilization with fear. And so dissolution is evolution in reverse, and basically under challenges, our body moves down the sequence. And we can see social engagement, calming, which is metabolically efficient. We can see the effect on the orbicularis oculi. We see the crow's feet, which, by the way, if you take Botox, you basically are taking away the signals that our nervous systems have evolved to detect exuberance and friendship and welcoming. So you might get rid of wrinkles, but people will not find you accessible or in many ways interesting. And we can see mobilization with fear can be metabolically costly. It's effective, but you can't do it for too long. And we can see that when you don't have access to this sympathetic and social engagement system, like a preterm baby, they will show initially tachycardia, which is access to the sympathetic nervous system, but they can't maintain that for a long period. And they often will now reflexly go and use this more ancient physiological system, which is prevalent in reptiles, of death feigning and immobilization. And what happens in the intensive care unit, this is my own research in the neonatal intensive care unit, babies will go into states of apnea where they stop breathing and massive bradycardia, where the heart rate is not sufficient to basically bring oxygenated blood to the brain. And so these become adaptive for reptiles, but potentially lethal for mammals. So that preterm nervous system doesn't have the social engagement system, doesn't have the ventral vagus, which constrains the sympathetic and dorsal vagal circuits into a more repurposed social utilization. Instead, the body goes into, in a sense, a dissolution. And this is really kind of the sequence that is found in the intensive care unit. And in fact, when they did autopsies on kids who died of SIDS, they found out that they had fewer myelinated vagal fibers, so which were the ventral vagus. So in a sense, the vagus, and whether it's a dorsal or a ventral, was determining the risk for SIDS. And we could see immobilization with fear, and this is the mouse in the jaws of the cat, in which the mouse loses consciousness and basically faints. And the problem with death fainting is that it doesn't support our oxygen needs. And so, like with small rodents, there's a time course in which they will be out and then they'll wake up and they'll scamper off. With humans, it's not as well defined in their behavioral repertoire, and there's great individual differences in the impact of syncope or fainting on our physiology. So we can see the dissolution pathway or sequence that when we're first challenged by any form of threat, we may use our language, we may use our facial expressivity, we use social communication to try to negotiate and navigate, and that is the ventral vagal complex, the VVC. If that is not successful, we will go into a more, let's say, primitive, a earlier evolutionary or phylogenetic stage, and now our executive functions of problem solving get more limited, but our body becomes more efficient in promoting mobilization, and the sympathetic nervous system takes charge of our autonomic state. And if it's overwhelming and it can't do that, like if there's great size differential or there's constraint on the physical person, the nervous system might be triggered to go into this dorsal vagal immobilization, which might be characterized by passing out or collapsing. Now, we often talk about the word freeze. Freeze is a more adaptive state in which the body maintains sufficient sympathetic tone to keep the muscles upright and to keep sufficient oxygen going to the body. So it's a more like a hybrid state between the sympathetic nervous system and the dorsal vagus. And more recently, I've been talking about dissociation as a very interesting, nuanced way in which the body does not go into the same types of defense systems, but maintains more optimal neural function, more healthy, but is psychologically someplace else. So neuroception is this system that we have that enables us to detect risk and safety. It's a detection system. It is not a perception. It's not within our awareness. So in a sense, we are wired with a detection system that triggers scripts in our body to support our safety or support our defense. So neuroception triggers this dissolution and fosters homeostatic processes of health, growth, and restoration. It's a portal to reverse threat-induced dissolution by that portal is if you detect signals of safety, it will, in a sense, reverse those threat reactions. However, neuroception of threat is shared by virtually all living organisms, even if we think about single cells and plants. The nervous system, through the whole history of living organisms, has been designed to deal with threat. However, a neuroception of safety is different than not just removing threat. It's actually the induction of signals that turn off threat and optimize another system, literally a safety system. And this is unique to mammals and their repurposing of the autonomic nervous system. And it forces us to reconceptualize what safety is. So safety is not merely the removal of threat. Safety is optimistically, there is no threat, but safety requires an additional input, and that is signals of safety. And so neuroception is functionally our own personal onboard TSA agent. And what it does is detects features in the environment as safe, dangerous, or life-threatening, and shifts our physiological state. And then those physiological states are literally neural platforms for categories of behavior that we could call social engagement, fight, flight, or shutting down. But that's not the world we want to be in. We want to be in a world that is safe with signals of safety. And when we're in a world that has signals of safety, all attributes of our autonomic nervous system are repurposed. So we use the social engagement system to talk and interact. But if we want to go motor activity that is playful, reciprocal, we recruit the sympathetic nervous system, but we keep it regulated or contained with the social engagement system, the ventral vagus. Similarly, if we are safe with others, we can give up our mobilization defenses and our bodies can conform, but they're not just going into a state of dorsal vagal regulation, they're being repurposed by feeling safe with the individual, and then their bodies are defensiveness is removed from their body. We can look at kittens playing, and we can start seeing some of this in action. So we first want to look at the kittens as making face-to-face contact. They are concerned, or let's say their play behavior is requiring face-to-face. So wherever they turn, they're going to maintain face-to-face because it's through the face and through the vocalizations that they are cueing each other that they are not being aggressive with each other. If you look at the kittens, their claws will be retracted, and even when they bite, it's not a bite to break skin. And when I was in graduate school, I saw pictures like this, and I was being taught in courses like comparative psychology that the cats were literally practicing their hunting skills. But in reality, what these kittens are practicing is their co-regulation and skill sets. So they're able to calm or play and turn off their mobilization. And what this enables cats to do is literally sit for long periods of time. Cats are good self-regulators because they are aware of their physiology. And when that self-regulation needs movement, they will move. But the point of this is in observing cats, we need to observe it from their physiology, not from ours. And they are signaling each other that they are playful, are playing with each other. If you watch dogs play, dogs will do the same thing. They might chase each other and do a light bite on the rear foot, and then the dog will turn to look at the others, and then they'll roll reverse. That looking after the bite is the reassurance that this was not an aggressive act. And you can see children playing. And what do you see in this picture? You see they're moving. But are they under fight or flight? And of course, you say, of course not. They're smiling. And the point is that's the social engagement system. So the movement is not fear-induced mobilization, but it is social. It's without fear. It's social. And again, we can go back to this conforming of bodies of immobilization, linking homeostatic processes, enabling the body to give up its defenses to do the processes of healing. So what happens when we lose the social engagement system? And this becomes almost a list of the core deficits of many individuals who have various mental health diagnoses. And also people who have had severe medical disruptions, they'll have some of the same features. One, their voice will lose its prosody, its intonation. It will sound more monotonic. It will not be as attractive in pulling people in. There'll be poor eye contact and difficulties in social communication, blunted facial expressivity, difficulties in behavioral state regulation, and this could be hypervigilant, anxiety, distractible, impulsive tantrums, and even hypoaroused, meaning just not moving at all. And if we want to go and look at mechanisms, we would probably find compromised vagal regulation. And we see that in terms of the heart, in terms of state regulation, but also in terms of the gut. So in many individuals who have had disruptions in their life, severe adversity, it's going to be manifest in digestion. And that is telling you that it's dissolution. The body has now gone to that subdiaphragmatic vagus. Instead of supporting digestive processes, it's turning off the digestive processes. And what you find with compromised vagal regulation about the gut, you'll find constipation when the sympathetic nervous system is on board, but the sympathetic nervous system has to take a break. It can't do it. It's metabolically too costly. And when that occurs, the dorsal vagus comes on, and that's when you start getting these oscillating symptoms that characterize irritable bowel syndrome. Difficulties in listening, following verbal commands, and speech and language delays. And this is when the nerves of the social engagement system regulating the middle ear muscles aren't working. In a sense, the middle ear, by not having tension on those muscles, the eardrum becomes looser. And when the eardrum is looser, it's like loosening the skin on a kettle drum. And so lower frequencies are now dominating the acoustic environment for the individual. And so they become greatly acutely tuned to low frequency sounds, which through evolution are triggers of predator. Low frequency sounds, thunder, earthquakes, people walking behind you on a strange street. Low frequency sounds trigger a script to our physiology. And then with this loosened middle ear structure that is now attuned to detect low frequency sounds, people start having auditory hypersensitivities. They can't hear what people are saying in restaurants. They don't want to go to shopping malls. It's too difficult to extract the sounds because the low frequency sounds are blunting the ability to extract voice. And then for some people, the same system is also related to oral, motor, or ingestive behaviors. And you'll start seeing people with selective eating, where they will eat specific foods only. And those foods will often be high-fat foods that have a sense, they have a calming effect because they constrict the pylorus and kind of stabilize blood sugar. So people will start eating to calm. And eating to calm is also through the ingestion, like a nursing baby, but it's not very effective in calming. It's much more, I would say, social behavior is more effective to calming. And so many people with eating disorders will try to use food to calm, and it won't be very effective. Not only that, when they ingest food, they will often do it outside of a social context. And eating historically has had a social context to it. So adaptive consequences of moving into the state of taking away that ventral vagal circuit, it disrupts the features of the ventral vagus, which are going to affect the heart, the facial expressivity, intonation of our voice, the ability to listen. It depresses all the features of the social engagement, but there's an upside. It permits efficient increases in sympathetic excitation, which now enables us to be more efficient defensive organisms. And this includes inflammation. And that is, inflammation is part of that defense system. And in fact, the vagus is anti-inflammatory. So you can start seeing the other side of the picture. And the issue is that inflammation is an effective defensive strategy. And acute inflammation may have a totally different function than chronic. And so what happens, of course, after trauma and stress is that there's chronic retuning of the autonomic nervous system, and that may support chronic inflammation as well. And on a sensory level, people are going to be hypersensitive because the body is now prepared to detect threat and asocial. So we start seeing these predictable situations, and an important take-home theme is that the autonomic nervous system supports health, growth, and restoration only when not recruited for defense. That loss of the social engagement system, including the protective ventral vagal system, results in a neurophysiological state that supports defensive behaviors, and when chronic, promotes mental and physical disorders. So the issue is, it's not necessarily bad that the social engagement system went offline. It's the fact that it went offline chronically. Medically unexplained symptoms and functional disorders, including irritable bowel syndrome and other autonomic problems, are frequent comorbidities of trauma and chronic stress. And what happened to many of us during the pandemic, and we can start seeing that the pandemic, we were experiencing a threat to our nervous system, and we also had a limitation of the opportunities to co-regulate with other people. Our sociality changed, our social options changed. And this violated, let's say, the historical script that humans evolve with, and that is under threat. threat was mitigated through sociality. And during the pandemic, sociality also became a threat. And this created many of the experiences that most of us have had. So it's this whole notion of linking sociality to homeostatic functions, evolutionary journey of sociology through co-regulation. It triggers, sociality triggers a neural mechanism to turn off threat reactions, basically turning off the defenses of our autonomic nervous system while optimizing homeostatic functions. It links sociality with homeostatic functions and elevates the role of sociality as both a homeostatic process and as a neuromodulator supporting homeostatic processes. It reframes psychological experiential constructs of threat, stress, and anxiety as objectively disrupting homeostasis. So through the lens of polyvagal theory, terms, psychological constructs like threat, stress, and anxiety become they become misdirections because we start interpreting them based on their physical attributes, when in reality, the effect is really what do these signals do to our physiology? If our physiology maintains homeostasis when confronted with it, then they are not threats or stresses or anxiety, because threats or stress or anxiety is really operationally defined by disrupting homeostatic functions. Now, this places physiological feelings of safety at the foundation of human experiences, relationships, society, self-actualization, and even spirituality. Everything that emerges in our complex nervous system, our decision-making, our problem-solving, our creativity, requires that our bodies feel safe enough that we can venture into those attributes of our nervous system. Trauma disrupts sociality and is a challenge to our evolutionary history. So this is a new paradigm with an optimistic perspective because it emphasizes that it's not neuroplasticity, it's not neural damage. It assumes that autonomic state influences behavior, reactions to the environment, self-regulation, and co-regulation. So it basically assumes a more parsimonious mechanisms that these features are naturally occurring adaptive reactions primarily determined by biobehavioral state. And our job is now to trigger signals of safety to allow that nervous system to come back to its normal, optimistic, engaging self. And the focus on how this model affects how the world of trauma is the theory transforms the client's narrative from a documentary that emphasizes events and objects to a pragmatic quest that's wired into us for safety with an implicit bodily drive to survive. So we now have great respect for underlying bodily feelings. And it contrasts to ACEs, which, by the way, are very important, but ACEs emphasizes events, while polyvagal theory emphasizes feelings. And in a way, it focuses on a restatement that we could say that what if Descartes were polyvagal informed? He would not say, I think, therefore I am. He would say, I feel myself, therefore I am. And so the point is, I feel myself. This slide's wrong, but basically I had it in the French because in French he uses one could use the reflexive form. In English, we tend to think of feel, and feel could be touching or feel could be internal. And that's part of our language doesn't allow us to investigate those internal feelings. I want to basically mention that polyvagal theory is now accessible in a readable way. My son, Seth, who is, I would say, an orator and a filmmaker and a journalist, actually has written with me a book that is accessible to people. And if you're interested in the Traumatic Stress Research Consortium, just send an email and you can join our consortium. So thank you. And if you want more information, you can go to my websites. Thanks.
Stephen, thank you so much. That was incredible, as I knew it would be. You're amazing. And I wish we had 2 hours to discuss this. We have 1 minute for one question. We've had a lot of questions come in. But there's one which has been upvoted, which seems to be the most popular among the many. And since we have time for one, I will quickly ask it. It sounds like what you're saying is that for trauma or other therapies to be effective, we first need to set patient up for success by restoring more of a parasympathetic state. Effectively, we need to reduce the stress response first. Is that correct?
Yes, but it's not just reduce, because we come, basically, we're wired with onboard mechanisms that reduce the stress response, and that is the recruitment of this parasympathetic limb, the social engagement system. It will reduce it. That's why sociality works. That's why listening works. But there's also an important clue here, is nervous systems that have been traumatized find safety or signals of safety risky. In a sense, it triggers vulnerability. So the insightful therapist has to get the person into that state of accessibility, but the person has to then be comfortable with being accessible. And that means through titration and basically sampling that space. So people who have had severe trauma, being accessible is a sign that they'll be traumatized again. And that's where therapists have to be clever and have to understand what the goal is to get that body calmer. And so medication can literally downregulate behavior and physiological state, but it doesn't enhance the neural regulation of those calming systems. So there may be a place for acute medication, but it may not be very effective in recruiting the ability of the nervous system to process signals of safety.
You are a master. Thank you.
Well, thank you for the kind words, and thank you for inviting me.
Thank you, Stephen. Take care. Thank you so much for listening to the Mind Health 360 show. I hope that we've helped you realize that mental health symptoms have root causes that can and need to be addressed in order to sustainably heal, and have given you some ideas about steps you, your loved ones, or clients may take to start their healing journey. Please share this interview with anyone you think may find it helpful, and don't forget to subscribe to keep up to date with our latest interviews on integrative mental health. If you want further information, please go to www.mindhealth360.com or find us on social media. This information is for educational purposes only and is not intended to diagnose or treat any disease or to replace medical advice. Please always consult your healthcare practitioner before discontinuing any medication or implementing any changes in your diet, lifestyle, or supplement program.